13% of adults in Zambia between 15 and 49 years are HIV positive. A pregnant woman may transmit the HIV virus to her unborn child if she does not seek medical assistance. Like many other countries, Zambia is working towards an HIV-free generation through the implementation of the option B+. 68 SHAS health facilities all over the country are implementing the option B+. Option B+ is a prevention of vertical transmission approach for expectant mothers living with HIV, in which women are immediately offered treatment for life, regardless of their CD4 count. Toward that end, SHAS continuously trains hospital staff and provides the needed life-saving antiretroviral drugs. Medical teams do not wait for the pregnant women to come to them, but it is them who go to the villages and visit the rural health centers. On the first antenatal visit, the first thing for every pregnant woman to do is take an HIV test. For if they don't know that they are positive, then the transmission to the child cannot be prevented.
After testing now, we tell them their results. That is what we call post-test counseling. You see, when we give the results, whether positive or negative. Now, if the woman has been found to be positive or the husband has been found to be positive, there and then the hospital starts giving them the ARVs so that they can prevent the child inside their womb.
If the pregnant woman is HIV positive, then she is immediately put on antiretroviral therapy. The aim is to reduce the viral load of the mother as much as possible, so as to protect the unborn baby from transmission. During the pregnancy, the viral load of the mother is closely observed and is tested a couple of times. The hospitals receive the medicines for this treatment from SHAS. The next important stage comes right after delivery. A child is put on antiretroviral drugs immediately after being born. The nurses instruct the mothers on how to give the medicine. Without treatment, the risk of transmitting HIV to the child is about 40%. With treatment, the chances of transmission are very slim. Next, after 6 weeks, there is the first HIV test. It is a dry blood spot test. If the baby is negative, nothing has to be done. In very rare cases, if the mother has not taken her medicine, the baby could be positive. Then it would get a pediatric antiretroviral treatment. After half a year, this test will be repeated.
Some of them come from even as far as 15 kilometers from the hospital, but they make it on foot. That sense of commitment is a sign of appreciation for the service, and a number of them who have actually proven it for themselves when they were earlier on tested HIV positive, they've ended up seeing children that have ended up testing non-reactive, and that gives them encouragement. That kind of information has sunk down low in the community to the point that people are appreciating PMTCT now.
The baby might be in danger if its mother forgets the appointments for treatment. In this case, the hospitals use the program Mwana to effectively follow up on the mothers. The nurse follows up on all appointments, and when he realizes that somebody has failed to come, he sends an SMS to a community volunteer. The volunteer then visits the mother. He knows where she lives because he has taken care of her since she entered the PMTCT program. The community volunteers are trained by CHAS.
So, the message
In most cases, after the reminder, the mother begins to go to the health facility. Every child that has entered the Option B+ program does a regular HIV test after 1.5 years. This boy did the test and was tested HIV negative. The mother is happy about this.
And then after 6 weeks,
after the child was born, I was told to go back to the hospital after 6 weeks for tests and later again after 6 months. Then finally, the child was tested again and was found negative.
Most CHAS member hospitals are located in rural areas. The people there depend on these hospitals as the only way to get treatment for their children.